So it'd be useful just to go through the interview schedule for the new medicine intervention.
Mm-hmm. Well, this is the one which we developed for the research, and then it's been further developed with various people having input to make it as good as possible. And the style of it's really important. I think it matters so much that it's gentle, everyday, open language, just asking about the patient and what they're experiencing in the world, lots of open questions, very basic and simple, and just see what comes back from the patient.
So the first question is, have you had the chance to start taking your new medicine yet?
Yeah, we had some debate about this one because some people think it's a bit of a challenging first question, but in practice it seems to work really well. If you don't have it there, the problem is that people, if you assume the person's taking the medicine, then they may well go along with that assumption and start making things up. So it doesn't seem to be a problem for people. Because we say, have you had a chance to start taking it, it gives them a way out if they haven't. And of course, some people have decided not to take it at all, and you pick up those sorts of things at that stage.
The next question, very nice and open, how are you getting on with it?
Yeah, it couldn't be more general and open, really, can it? And that's because you don't know what's in the patient's head, what matters to them, how they understand everything that's going on. It just gives them space to say what they want, really. Anything they want to tell you about it. And if they suddenly start talking about side effects, then you go down to the side effects question and you sort of follow up those things rather than having to go through each question in order. So it's a really good general open question, and you may then be talking for 10 or 15 minutes out of that question, and you just pick up the other things later on just as a check that everything's been covered.
And then we have a more focused question asking, are you having any problems with your new medicine or concerns about taking it?
And again, how are you getting on with the medicine? People may think, well, that relates to how it's affecting their body, but they may be really worried about things and they wouldn't bring that out. So again, it's a chance for them to air their concerns and worries and bring them out into the open and for you as the pharmacist to deal with them.
Next question, do you think it's working?
People like to think that their drugs are working, not surprisingly, and sometimes they stop taking it because they don't think it's working, but their idea of how the drug works and what working means may be very different from ours and from medical wisdom generally. So it's important to establish it, because if they don't think it's working, the classic being they're taking antihypertensive and they don't feel any different, then it is very likely to affect their behaviour. So it's a chance to get that out of the way and to start explaining sometimes about how the drug works and whether they know whether it was working or not.
And then following up, asking patients directly, do you think you're getting any side effects or unexpected effects?
And again, we phrase it two ways to open it up for patients, so that depending how they see the world, if they're not sure. Some people are worried about labelling something a side effect, so they feel a bit funny. Is that a side effect? Well, probably no, side effect's probably a rash or something. But it's a concern in their mind, and so it's a chance, the unexpected effects gives them a chance to talk about it. And of course, it's very hard to know whether drugs really are giving side effects or not. It's something important that pharmacists know the side effects of the drugs, the common ones, but also have to be able to find out about the rarer ones as well. But it's, in our original study where we were asking people, or following up people who have started a new medicine, half the problems were side effects. So we'd expect something to be quite commonly come out here to be dealt with.
And then the next question asks about patients' adherence. And the phrasing is, people often miss taking doses of their medicines for a wide range of reasons. Have you missed any doses of your new medicine or changed when you take it?
Yeah, this is a fairly classic way of making it open for patients to talk about non-adherence. And of course, to many patients, non-adherence is a rational thing. They've either got a rationale themselves from their beliefs or understanding of the world for why they're not taking it, or they want to take it and there's some barrier which isn't their fault and they want to tell you about it. So it does pick out a lot of the cases of non-adherence. It is important to know what exactly the patient is doing with the medicine, and changing when you take it is another way of checking up on that. And you can just sort of try and make sure that so exactly how they taking it. You could do a little follow-up just to make sure that they haven't misunderstood the instructions and that you're both looking at the same label but interpreting it differently. So it's a chance to talk about non-adherence, the reasons for non-adherence, and to give advice to help adherence. You know, and it may be things to do with memory and creating habits. It may be things to do with, you know, reassuring people that side effects are quite transitory and will disappear, that sort of thing.
And very non-judgmental as well, that phrasing.
Yes, yeah, absolutely. It's so important not to say, you know, we've been really keen that this isn't a service to make people adhere. It's a service to solve people's problems.
Yes.
If they're not adhering, then we talk about that, and that may be a very rational thing for them to do. And it may be better that they then go back and see their GP or do something else. But as you say, non-judgmental, we don't want to say, you know, a bad thing for not adhering.
Yeah. And then the final question, do you have anything else you'd like to know about your new medicine, or is there anything you'd like me to go over again?
Yeah, people. What happens when you interview people and you talk to them over time is sometimes you spoke about something near the start and it's been going on in the back of their mind, and they're just uncomfortable about it or weren't quite clear about it. So it's just a chance for all those sorts of things to come to the fore, for you to reiterate information clearly that you'd given. And sometimes this is when things like, well, actually, I was wondering, you know, how does it work and why I'm taking it? Quite fundamental questions like that often come up. And, you know, what you found from your interviews with patients was that information on how a drug works is really important to a lot of patients. It really helps settle them and feel more comfortable about adhering to their medication.
Yeah. Understanding why they're taking it and how it's going to help.
Yes, absolutely, absolutely.
So Nick, what would you say are the three key pieces of advice you'd give to pharmacists who are delivering this new service?
Well, I think the first one is you're there to help the patient, and to do that you really need to understand what's going on in their life and their world. The second is to do that, it's really important to use natural language, to use everyday language, and not fancy medical language. And the third is, which ties in with the above two, is that this interview schedule is a prompt, it's an aid memoir. You know, this isn't an interrogation. You're not getting them sitting there with the bright lights and asking these questions in strict order. You know, a good interview will flow like a natural conversation would. And to just let it flow and just have in your head these things, problems and concerns, side effects, is it working, adherence. And around that, you can just make it flow and really make patients' lives better.
Great.